as we all know, the compliance is most important for any treatment to complete. If the patient is not compliant for the treatment, you won't get the result which is desired. So, as Cadila has introduced, 3-dose G protein vaccine for rabies, which is ultimate key for the compliance. As rabies is a public health challenge in India. Globally, 60,000, 59,000 death, highest in India. Okay, is seen. India has accounted for 20,000 deaths a year from rabies, accounting for 60% death in Asia and 35% globally, and 91% death in occurs in rural areas. There's has since there is less reach of vaccines in rural area as compared to urban area, and every 9 minutes there every person a single person dies of rabies in India. Current management, first of all, local wound treatment, first aid is should be given, then active immunization. If the wound, according to condition or position of the wound, passive immunization, immunoglobulins are also to be given. Bite wound post-exposure prophylaxis is a must. If you have seen that in today's protocol, there is 5-dose vaccination schedule on 0, 3, 7, 14, and 28 days for prophylaxis of rabies. You have to clean the wound with water and soap and give post-exposure prophylaxis. Current challenge of post-exposure prophylaxis is non-compliance. Current rabies vaccines are cell culture vaccines, and inactivated vaccines are more than 50-year-old technology, has inconsistent potency, stability, and availability, short supply, and has more adverse effects, side effects. Compliance is most important. Who receive full dose of ARV, the scheduled dose of ARV on recommended dose. Many times the dates are missed. Delayed compliance, who completed scheduled of ARV within 60 days but deviated from scheduled regimen, dropout, who had taken at least 1 dose of ARV after animal bite but not completed all schedules. Since we have seen that India, there is more of non-compliance for drugs and as well as this vaccine. In retrospective analysis, there is a limitation of 4 doses. At 5 doses should be given, but in this 4 doses of PAP, there is shortcoming. There is late initiation of PAP in travelers, administration of human rabies immunoglobulin and antibodies levels are less than. In this, the patient do not always receive optimal PAP, so there is significant patient varies many a times that may lead to death of the patient. As we have seen that there are many cases where non-compliant lead to death of the patient. Okay? There is less immunity development even after patient not taken the proper compliant doses, proper doses, since then 53% of non-compliant doses should receive there. As we have seen that in 60 days onwards, there is decrease of compliance. Less than 60% of patient reach for the 25th dose of the PP. Constraint for compliance to complete the course of anti-rabies vaccine. The cause due of non-compliance of PP is many of time school timings. Many child do not come for vaccination. They will lose their school or distance of hospital, cost incurred, many times patient forgot the dates, and main of 47% due to loss of wages. Evolution of rabies vaccine in 1885, we have remembered that 14 इंजेक्शन लगते थे पहले. Live attenuated vaccine spinal cord that has more of side effects have seen. Uh, in 1976, lyophilized immunogenicity inactivated vaccine, cell culture vaccine are introduced. Now, non-compliance has led to evolution in treatment regimen from 31 doses to 5 doses, and now the Cadila has introduced 3 vaccine doses, meeting the unmet need of medical needs. Novel 3-dose recombinant G protein vaccine, first protein having subunit vaccine lipoprotein VLP technology, first vaccine. The vaccine schedule is 037, better compliance due to easy flow of regimen and less visits and convenience, ready to use. VLP technology were native vaccines. In this, G protein is difficult to isolate. So with nanotechnology, where virus like protein is cultured, is made for which have immunogenicity, immune response, and give as well the response that is required for post-exposure prophylaxis. In this, there are in clinical phase 2 and phase 3, the safety and immunogenicity of 3-dose of recombinant rabies G protein vaccine is same as that of 5 doses. In this, 800 subjects are randomized control 2:1, given 037 regimen, 533 subjects and 267 subjects given 5 doses of Rabipur vaccine. In this, we have seen that the results have immune response as same as that of 5 doses, but there is reduced side effect in 3 doses. So novel 3-dose vaccine has non-inferior reference to the reference vaccine, less adverse effect as compared to reference vaccine, and novel 3-dose vaccine is found to be safe, immunogenic as comparable to 5 doses pre-qualified. In this, there is renowned given Pharma Innovation of the Year for Economic Times and Global Google Tiger Award Malaysia for innovation of the product. I think I've completed the topic, but any questions from the hello?
Yes, sir. Yes, sir.
Any questions from the side?
Yes, sir. We have question. 1 minute. 1 minute.
Hello.
Yes, sir. Yes, sir. सर वॉइस आ रहा है मेरा?
हाँ, थोड़ा सा वॉइस का इशू है. हाँ, बोलिए ना.
यस यस सर, एक डॉक्टर नम्रता है मंडलेश्वर से. उनका क्वेश्चन है, कैन वी गिव दैट पेशेंट हु ऑलरेडी डन 3 month ago 5 dose and again docs bite turn?
Generally 1 month before the patient has given.
Yes, sir.
Sorry. Hello.
Yes.
You first of all, you should not mix and match the vaccine. If the patient is given 3 dose, has started on 3 dose of vaccine, you should give the same vaccine. And if the patient has the given 5 dose vaccine, so there should not be mix and match of the vaccine. If the patient has taken 1 month back, you can give the 3 dose vaccine here.
Okay, sir.
Hello.
Yes, sir. Yes, sir.
I think
another question है डॉक्टर सलीम से गुगावा. हेलो हेलो.
हाँ
सर, उनका क्वेश्चन है, what the precaution taken by the patient if the vaccination is not available after dog bites?
सॉरी, मेरे को मुझे एक्चुअली क्या आवाज इसमें इतनी आ नहीं रही है
सर एक मिनट, अब आ रहा है सर वॉइस?
हाँ ठीक है।
हाँ सर, एक सलीम सर का क्वेश्चन है अपने गोगावा से कि व्हाट द प्रिकॉशन टेकन बाय द पेशेंट इफ द वैक्सीनेशन इज नॉट अवेलेबल आफ्टर डॉग बाइट्स।
If vaccination is not available in dog bite, vaccination is the must.
यस सर। फिर एक क्वेश्चन है सर, डॉक्टर रमेश सलोत्रे कसरावत, when can you give again?
हाँ हेलो।
हाँ सर,
हाँ
मतलब विद इन 3 मंथ में सर यदि डबल से डॉग बाइट होता है तो
हाँ
वैक्सीन देना है कि नहीं देना है सर?
3 मंथ के बाद होता है तो अपन दे सकते हैं, मतलब देना चाहिए आफ्टर
ओके
3 मंथ, बिकॉज इवन इम्यून रिस्पॉन्स रिसीड्स, मतलब उसमें इम्यूनिटी का जो इम्यून, इसीलिए अगर पोस्ट एक्सपोजर वैक्सीन तो देना ही है अगर 3 महीने बाद होता है तो।
यस सर। सर अगेन एक क्वेश्चन है डॉक्टर सुरेखा जैन धामनोर,
हाँ
इट्स सेफ फॉर बीच एज इन चिल्ड्रन?
सेफ फॉर
चिल्ड्रन मतलब कौन सी एज के लिए मतलब सेफ है चिल्ड्रन में?
सेफ है वैक्सीन।
ओके ओके सर।
हेलो,
एक सर क्वेश्चन है डॉक्टर
चिल्ड्रंस
संजय
को भी
शर्मा
दे सकते
हार्दक।
हैं। हेलो,
ओके, हाँ सर।
हाँ चिल्ड्रंस को भी दे सकते हैं क्योंकि पोस्ट एक्सपोजर प्रोफाइलेक्सिस तो भले किसी भी एज में हो आपको देना ही है।
यस यस सर। एक सर डॉक्टर संजय शर्मा हरदा का क्वेश्चन है कि सेफ इन प्रेगनेंसी, प्रेगनेंसी में सेफ है कि नहीं सर?
हाँ प्रेगनेंसी में भी सेफ है। आपको आपको एक्चुअली इसमें ये है कि अगर पेशेंट को सिम्टम्स डेवलप हो गए हैं तो उसको
यस सर।
फिर कोई नहीं, क्योंकि ये 100% मोर्टिलिटी वाली डिसीज है। तो इवन इन patients having, since this is nanotechnology and it is not actual virus,
ओके
as you have seen in VLP technology, it is not actual virus having high immunogenicity for antibodies to be formed, so it is safe in pregnant women also.
ओके सर। एक डॉक्टर दिनेश रघुवंशी
हाँ
का क्वेश्चन है कि इट्स सेफ फॉर 60 इयर्स अबोव एज पेशेंट?
सेफ और मतलब 12 साल के ऊपर तो वैसे दे ही सकते हैं।
हाँ सर, वही 60 इयर्स का लिखा है।
हाँ,
सर एक लास्ट क्वेश्चन है कि डॉग्स बाइट होने पर वैक्सीन देने के बाद बूस्टर डोज देना जरूरी है क्या?
डॉग
क्वेश्चन इज
बाइट में
फ्रॉम
क्या देने के बाद, सॉरी?
सर 3 डोज, आफ्टर 3 डोज बूस्टर डोज देना है क्या?
नहीं नहीं, कोई बूस्टर डोज की जरूरत नहीं है। इट, एज वी हैव सीन दैट इन द clinical trial, in 3 dose it has same response as 5 doses completed by the vaccine, other vaccine, Rabipur vaccine.
ओके ओके, नाउ क्वेश्चन इज ओवर सर।
सॉरी, थोड़ा टेक्निकल एरर की वजह से मुझे वॉल्यूम की भी प्रॉब्लम है,
ओके 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 सर।
थोड़ा कम्युनिकेशन।
Yes, sir. Thank you so much, Dr. Sir, for informative talk. We truly appreciate your efforts. Last but not the least, we would like to inform you that the Travis has won 2 prestigious awards in innovation category: ET India Pharma Award and Golden Tiger Awards. Now, thank you all participant doctors, and thank you Har sir again. Thank you, sir.
थैंक यू।
Thank you.